Welcome to the Health Awareness Podcast, your reliable companion for evidence-based health knowledge and wellness guide. Our goal is to keep you informed, supported, and empowered on your journey to better health. For links, updates, and additional resources, please check the description.
Welcome back, everyone, to the Health Awareness Podcast. I'm Jenny, your co-host, and I'm really glad you're joining us today for what I think is a super important conversation.
And I'm Mark. Jenny, you hit the nail on the head. Today, we're tackling a topic that truly can be life or death: understanding stroke warning signs. It's a subject I feel really passionate about, because the more people know, the more lives we can save.
Absolutely, Mark. Stroke is a major global health issue. It's actually one of the leading causes of death and long-term disability worldwide. But here's the thing. Many strokes are preventable, and if treated quickly, the outcomes can be dramatically better. That's why awareness is so crucial.
Exactly. Today, we're going to break down what a stroke actually is, go through the critical fast warning signs that everyone should memorize, and also touch on some lesser-known symptoms. We'll cover the main causes, how it's diagnosed and treated, and, perhaps most importantly, what steps you can take for prevention and what to do in a stroke emergency. Our goal is to empower all of you with this vital information. So, let's dive right in, Jenny. Many people have heard the term stroke, but what actually happens in the brain when someone has a stroke? Can you explain it in simple terms?
Of course, Mark. Think of your brain as a really busy city that needs a constant supply of energy and oxygen to keep everything running. This supply comes from blood, delivered through a network of tiny roads, your blood vessels. A stroke happens when something interrupts that blood flow to a part of your brain.
So, like a traffic jam or a bridge collapse in that city?
Precisely! There are two main types of strokes. The most common type, about 87% of all strokes, is called an ischemic stroke. This is where a blood clot, like a tiny dam, blocks one of those blood vessels, preventing blood from reaching part of the brain. It's like a traffic jam stopping all supplies.
And the other type?
The other type is a hemorrhagic stroke. This is less common but often more severe. It happens when a blood vessel in the brain bursts, causing bleeding into the brain tissue. This bleeding damages brain cells and also puts pressure on other parts of the brain. So instead of a blockage, it's like a pipe bursting, causing damage and flooding.
Wow, so either way, whether it's a clot or bleeding, the brain isn't getting what it needs, or it's getting damaged. And that leads to brain cells dying quickly, right?
You are right. Brain cells are incredibly sensitive. Without oxygen and nutrients, they start to die within minutes. And once brain cells die, they don't come back. This is why you often hear the phrase time equals brain. Every minute that passes during a stroke, more brain cells are at risk. It means permanent damage is more likely to occur, impacting things like speech, movement, and even memory.
That really puts it into perspective. Time equals brain. I think that's a phrase everyone needs to remember. And that leads us perfectly into the most crucial part of our discussion: the fast warning signs. This is an acronym that is truly a lifesaver, and we want everyone listening to commit it to memory. Jenny, could you walk us through each letter?
My pleasure, Mark. FAST is incredibly simple yet incredibly effective. Let's start with the F, which stands for face drooping. This is one of the most visible signs. If you ask someone to smile and one side of their face seems to droop or feel numb, that's a red flag. Perhaps their smile looks lopsided, or one eye won't close fully. You might notice the corner of their mouth sagging. It's often very subtle, but it's a critical sign.
I remember my aunt telling me a story about her neighbor. She was having a cup of coffee, and suddenly, her neighbor's face just looked a bit off when she smiled. She thought it was just a strange expression, but then she remembered seeing a public health campaign about FAST. It made her ask her neighbor to try and lift both sides of her face, and that's when she saw the drooping clearly. Good thing she acted quickly.
That's a perfect example, Mark. Trust your gut if something looks unusual. Next up is A for arm weakness. If someone is having a stroke, they might experience sudden weakness or numbness in one arm. You can test this by asking the person to raise both arms straight out in front of them, palms up, for about 10 seconds. If one arm drifts downward or they can't lift it at all, that's a serious sign. It often affects one side of the body.
So, like if they're trying to reach for something and they just can't quite get their arm to cooperate, or they drop something they were holding without warning?
Exactly. A sudden, unexplained drop of an item or an inability to hold something steady can be an indicator. It's not just a clumsy moment, it's a sudden loss of control on one side. Then we have F's, which stands for speech difficulty. This can manifest in several ways. The person might suddenly have slurred speech, making them sound drunk even if they haven't had any alcohol. Or they might struggle to find words or have difficulty understanding what you're saying to them. They might speak in jumbled sentences or just be unable to communicate clearly at all.
I can imagine how confusing that must be, both for the person experiencing it and for those around them. You might think they're just tired or distracted. I heard about a gentleman who was trying to order coffee, and the barista just couldn't understand what he was saying. Luckily, another customer recognized the slurred speech as a stroke symptom and alerted staff.
That's a fantastic story of bystander intervention. It shows how paying attention can make all the difference. And finally, the T in FAST, which is arguably the most important, stands for time to get emergency help. If you observe any of these signs, face drooping, arm weakness, or speech difficulty, even if they seem to disappear, it's absolutely crucial to call emergency services like 911 or your local emergency number immediately. Don't wait. Don't drive them to the hospital yourself. Let the paramedics assess them and get them to the right facility.
That really circles back to what was said earlier about time equals brain. It emphasizes that urgency is key. So, FAST. Face drooping, arm weakness, speech difficulty, time to call emergency services. Everyone, please remember that. But Jenny, are there other symptoms people sometimes miss, beyond the FAST signs, that could also indicate a stroke?
Absolutely, Mark. While FAST covers the most common and recognizable signs, there are several others that people might dismiss. One is a sudden severe headache, often described as the worst headache of my life. This is especially true for hemorrhagic strokes, where the bleeding causes immense pressure.
So, not just a regular migraine, but something completely out of the ordinary in its intensity and suddenness.
Exactly. Another often missed symptom is sudden vision loss, or a sudden change in vision in one or both eyes. This could be blurry vision, double vision, or even a complete loss of sight in one eye. People sometimes think it's just an eye problem, but it can be a sign the brain's vision processing center is affected.
That's something I wouldn't have immediately linked to a stroke, honestly. What else?
There's also sudden dizziness or loss of balance and coordination. Someone might suddenly stumble, feel profoundly dizzy, or have trouble walking in a straight line, as if they've lost their sense of equilibrium. Think of someone who suddenly can't stand upright without swaying or falling.
And I suppose that could be confused with just feeling faint or being clumsy, which is why recognizing the suddenness is key.
Spot on. Also, sudden confusion or disorientation, and a sudden trouble understanding speech, even simple commands. This is different from slurred speech. It's more about the brain's ability to process information. Someone might seem completely out of it or unable to follow a conversation. All of these, when they come on suddenly and without clear explanation, warrant an emergency call. They indicate that something serious is happening in the brain and it needs immediate medical attention.
That's incredibly helpful. It just reinforces that if something feels suddenly and drastically wrong with someone's neurological function, it's best to err on the side of caution. Now, Jenny, let's talk about why strokes happen. What are the major risk factors people should be aware of?
Great question, Mark. Understanding the risk factors is crucial for prevention. The biggest one, hands down, is high blood pressure. If your blood pressure is consistently high, it puts extra strain on your blood vessels, making them weaker and more prone to clots or bursting. It's like constantly running your pipes at maximum pressure. Eventually, they'll wear down or burst.
So keeping an eye on your blood pressure isn't just for heart health, it's for brain health too.
Absolutely. Next up, diabetes. High blood sugar levels over time can damage blood vessels throughout the body, including those in the brain, increasing the risk of clots. Similarly, high cholesterol contributes to the buildup of plaque in arteries, a process called atherosclerosis, which narrows the vessels and can lead to clots.
So these are all interconnected, really. What about lifestyle factors?
Definitely. Smoking is a huge one. The chemicals in cigarette smoke damage blood vessels, make blood thicker and more likely to clot, and raise blood pressure. It's a triple threat. And obesity often goes hand in hand with high blood pressure, diabetes, and high cholesterol, compounding the risk.
It sounds like many of these are factors we actually have some control over.
Many are, yes. Another important one is atrial fibrillation, or AFib. This is an irregular heartbeat that can cause blood to pool in the heart and form clots. If these clots travel to the brain, they cause an ischemic stroke. A sedentary lifestyle, meaning not enough physical activity, also contributes to all the other risk factors like obesity, high blood pressure, and diabetes. And don't forget stress. Chronic stress can elevate blood pressure and lead to unhealthy habits, indirectly increasing stroke risk.
So it's not just physical health. Mental well-being plays a part too. What about things we can't control, like genetics?
You're right, family history also plays a role. If a close relative has had a stroke, especially at a younger age, your risk might be higher. But even then, managing the controllable risk factors becomes even more critical. Essentially, many of these factors damage your blood vessels, making them either more likely to clot or more prone to bursting.
That's a really comprehensive overview. It shows that managing our overall health is so vital. Let's say someone experiences stroke symptoms and emergency services are called. What happens then? How is a stroke diagnosed in the emergency room?
This is where that time equals brain really comes into play. Upon arrival at the hospital, the medical team acts incredibly fast. The first priority is to confirm it's a stroke and determine what type. This usually starts with imaging scans. A CT scan of the brain is often done immediately. It's quick and can show if there's bleeding in the brain, which would indicate a hemorrhagic stroke.
So they're looking for that burst pipe right away.
Exactly. If the CT scan doesn't show bleeding, it usually means it's an ischemic stroke, caused by a clot. Sometimes a more detailed MRI scan might also be performed. It gives an even clearer picture of brain tissue and can pinpoint damaged areas more precisely. Alongside imaging, doctors will perform a quick neurological exam to assess things like strength, sensation, balance, and speech. They'll also run blood tests to check for things like blood sugar levels, clotting factors, and any other underlying conditions. All of this is done to get a clear diagnosis as quickly as possible, because treatment windows are very narrow.
It sounds like a highly coordinated effort to save brain cells. Once they've diagnosed the type of stroke, what are the treatment options available?
Treatment depends entirely on the type of stroke. For an ischemic stroke, where a clot is blocking blood flow, the primary treatment is often a clot-busting medication called TPA, or tissue plasminogen activator. This medication dissolves the clot, restoring blood flow. But it has to be given within a very specific time frame, usually within 3 to 4.5 hours of symptom onset, so quick action is vital.
So that's literally dissolving the traffic jam to get things moving again.
That's a great way to put it. Another advanced treatment for ischemic stroke is mechanical thrombectomy. This is a procedure where a specialist inserts a catheter into an artery, usually in the groin, and guides a tiny device up to the brain to physically remove the clot. This is typically for larger clots in bigger vessels, and also has a strict time window, usually up to 24 hours in very select cases, but sooner is always better.
And for hemorrhagic strokes where there's bleeding?
For hemorrhagic strokes, the approach is different. The goal is to stop the bleeding and relieve pressure on the brain. This might involve medications to lower blood pressure, or in some cases, surgery to repair the damaged blood vessel, remove the blood clot, or relieve pressure. After initial treatment for either type, patients often go to an ICU for monitoring and then begin rehabilitation therapy to regain lost function. This can include physical, occupational, and speech therapy, and it's a critical part of recovery.
It's incredible what modern medicine can do, but it all hinges on that early recognition and rapid response. Let's shift gears now to prevention, which, as we discussed, is so important. What practical tips can our listeners implement to reduce their risk of stroke?
Prevention is key, Mark, and many steps are quite straightforward. First and foremost, manage your blood pressure. This might involve medication prescribed by your doctor, but also lifestyle changes like reducing salt intake and staying active. Aim for a blood pressure below 120/80 millimeters Hg if possible, or whatever your doctor recommends.
And the same goes for managing blood sugar and cholesterol, right?
Exactly. If you have diabetes, work closely with your doctor to keep your blood sugar levels in check. For cholesterol, focus on a diet low in saturated and trans fats, and again, medication if necessary. Regular exercise is a game changer for all these risk factors. Aim for at least 150 minutes of moderate intensity exercise per week. That's like a brisk 30-minute walk 5 times a week. It strengthens your heart and keeps your blood vessels healthy.
So moving your body consistently. And what about diet? Eat heart-healthy foods is something we hear a lot, but what does that really mean in practice?
It means prioritizing fruits, vegetables, whole grains, lean proteins, and healthy fats like those found in olive oil and avocados. Think colorful plate. And specifically, reduce your salt intake, as excess sodium is a major contributor to high blood pressure. Check food labels for sodium content. It hides in a lot of processed foods.
Small changes can really add up there, and I know you're passionate about hydration, Jenny.
You bet. Drink plenty of water. Staying well hydrated helps maintain healthy blood volume and can prevent blood from becoming too thick, which can increase clotting risk. And of course, if you smoke, stop smoking. It's one of the most impactful things you can do for your overall health and significantly reduces your stroke risk almost immediately.
That's a huge one. And we talked about stress earlier. How does that fit into prevention?
Manage stress effectively. Whether it's through meditation, yoga, hobbies, or spending time with loved ones, finding healthy outlets for stress can help keep blood pressure down.
Finally, and this is really important, schedule regular medical checkups. Your doctor can monitor your blood pressure, cholesterol, and blood sugar and address any potential issues before they become serious. Don't wait until you feel unwell to see your doctor. These are all actionable steps that collectively make a huge difference. Now, let's revisit that critical T from FAST. What should someone do, step by step, if they suspect someone is having a stroke? This is for those moments when every second counts.
Okay, this segment is extremely important. If you suspect someone is having a stroke, or even if you're not sure but just have a strong feeling something is wrong, the absolute first and most critical step is to call emergency services immediately. In most places, that's 911. Do not hesitate. Do not wait to see if it passes. Do not try to drive the person to the hospital yourself. Paramedics can start medical care on the way and notify the hospital, preparing them for the patient's arrival. This shaves off precious minutes.
So, the priority is getting those emergency responders involved right away. What about while waiting for help to arrive?
While waiting, do not give the person any food or drink. Their ability to swallow might be impaired, which could lead to choking or aspiration, food or liquid going into their lungs. Similarly, do not let the person go to sleep. You need to keep them awake and monitor their symptoms until help arrives. And most importantly, stay with the person and keep them safe. Try to keep them calm, loosen any tight clothing around their neck, and if they've fallen, try to cushion their head. If they vomit, gently roll them onto their side to prevent choking. Just be there and reassure them.
Those are such clear, simple, yet vital instructions. It boils down to acting fast, calling for professional help, and then keeping the person as safe and comfortable as possible until that help arrives. All right, Mark, let's bring it all together. What are the 4 to 5 key takeaways you want our listeners to walk away with today regarding stroke awareness?
Excellent summary, Jenny. My main takeaways would be these. First, recognize the fast signs: face drooping, arm weakness, speech difficulty, time to call emergency services. Memorize them, share them. Second, time is brain. Every minute counts in a stroke, so acting immediately saves lives and minimizes disability.
Third, don't ignore additional symptoms like sudden severe headaches, vision changes, or dizziness. These also warrant an emergency call.
Fourth, manage your risk factors through lifestyle choices and regular doctor visits. High blood pressure, diabetes, smoking, these are largely controllable. And finally, always call 911 or your local emergency number immediately if you suspect a stroke. Don't self-diagnose, don't wait.
Those are powerful points, Mark. Thank you so much for breaking down such a complex and critical topic into something so understandable and actionable. This information truly has the potential to save lives and prevent devastating long-term effects.
My pleasure, Mark. It's truly a topic that I believe everyone needs to be familiar with. Knowing these signs really empowers you, not just for yourself, but for your family, friends, and even strangers you might encounter.
To all our listeners, please take these messages to heart. Share this episode with your loved ones. Talk about the fast signs around the dinner table. You never know whose life you might impact simply by spreading this awareness. It could be the most important conversation you have this week.
Absolutely. Thank you for tuning into the Health Awareness Podcast today. We hope you feel more informed and prepared. Don't forget to subscribe wherever you get your podcasts so you don't miss our upcoming episodes.
And next time, we'll be tackling another crucial aspect of heart and brain health: cholesterol. We'll dive into the good versus the bad and how to control it naturally. It's going to be another insightful one. Until then, stay healthy, stay aware, and take care of yourselves and each other.
See you next time.